Hello, everyone. On behalf of the Centers of Medicare and Medicaid Services, CMS, Divisions of Tribal with for Clinical Standards and Quality, I'd like to welcome everyone to the All Tribes listening session. My name is Michaela Holm, and I work with Kaufman and Associates, and I'll be your moderator today. Today's webinar is titled CMS Listening Session, Indian Health Services, IHS, Tribal and Urban Health Care Providers on Emergency Preparedness. At first, I'd like to go over the disclaimer that this webinar series is supported by an award by Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. At this time, I will turn it over to Beverly Lofton. Thank you.
Thank you so much, Michaela. Welcome, everyone. My name is Beverly Lofton. I'm a senior policy advisor, and I work in the Division of Tribal Affairs. So welcome to today's webinar. So today's listening session is in partnership with the CMS Center for Clinical Standards and Quality to obtain feedback from Indian Health Service, tribal and urban health care providers, and emergency response staff regarding emergency preparedness requirements for Medicare and Medicaid participating providers. Materials from this session can be found on our spotlight page of the CMS American Indian and Alaska Native Outreach and Education website that can be found at go.cms.gov/AIAN. At this point, I'd like to turn the webinar over to Katie Derby, who will begin the presentation and introduce the other presenters for today. Katie.
Thank you. As Beverly mentioned, my name is Katie Derby, and we are happy to have you join us today as we gather information on emergency preparedness. Everyone's audio will remain in listen-only mode until the feedback portion of today's listening session. This call is being recorded. If anyone has any objections, you may now disconnect. Additionally, members of the press are welcome on today's call. However, all press and media questions should be submitted using the CMS Media Inquiries form, which may be found on the CMS website at www.cms.gov/newsroom/media-inquiries. At this time, it is my pleasure to introduce you to Lauren Oviatt, the Director of the Division of Non-Institutional Quality Standards at CMS, to provide additional information on the goal of this listening session and what we plan to do with the information.
Good afternoon. As Katie mentioned, I'm Lauren Oviatt, Acting Director of the Division of Non-Institutional Quality Standards at CMS. I wanted to start out by saying that we appreciate your time and willingness to share your feedback with us during today's listening session. The Clinical Standards Group is responsible for the development of the conditions of participation and conditions for coverage. These regulations are the health and safety standards that providers must meet in order to participate in the Medicare and Medicaid programs. Currently, there are conditions for 21 provider and supplier types. These regulations apply to all individuals that receive care in the facility, regardless of payer. In 2016, CMS established national emergency preparedness conditions for Medicare and Medicaid participating providers and suppliers to plan adequately for both natural and man-made disasters and coordinate with federal, state, tribal, regional, and local emergency preparedness systems. The conditions also require providers and suppliers to prepare to meet the needs of patients, residents, clients, and participants during disasters and emergency situations. There have been some revisions made to these emergency preparedness requirements made in 2019. You were provided with links to both of these regulations in the announcement for this listening session for your reference. Since the emergency preparedness rules have gone into effect, communities have experienced short and long-term emergency scenarios, including major storms, fires, security breaches, supply shortages, and outbreaks of infectious disease. These emergencies have ranged in scope from individual units within facilities to regional disasters and an international pandemic. While most communities have been able to exercise plans developed under these requirements and provide high-quality services to patients during these events, The healthcare system as a whole has been tested and strained by unprecedented situations and the ongoing COVID-19 public health emergency. In light of these events, we are in the process of reviewing the conditions for emergency preparedness to determine whether any updates are needed. Today, we are posing questions that cover a variety of topics related to emergency preparedness, such as innovative approaches taken to address impacts of emergency situations, resources available to support healthcare workers, participation in emergency preparedness exercises, and what CMS can do to ensure a more resilient healthcare workforce during emergencies. Now I'll turn it back over to Katie to begin discussing the questions.
Thanks, Lauren. At this time, we will begin taking responses to the 5 questions shared in advance in the announcement for today's listening session. I will begin by reading the question. If you would like to provide input to that particular question, please use the raise hand button at the bottom of your Zoom screen to join the queue to share input. Please limit your input to only the question that I announce at that time. In order to get through all 5 questions in the amount of time that we have today, please keep your feedback timely so that we can give as many participants as possible the opportunity to provide input. When I call your name, please unmute your line, give your name and the name of your organization along with your comment. For those joining by phone, please press star followed by the number 9 to raise your hand to join the queue. Do the same to lower your hand if you wish to be removed from the queue. When you hear your name called, please unmute yourself, state your name and organization, and provide your input. Please note your line will remain open during the time that you're providing your feedback, so anything you say or any background noise will be heard in the conference. As a reminder, this event is being recorded. We will now hear your feedback on question 1. How has the extended duration of the COVID-19 public health emergency affected the workforce at your facility and/or employer? How has your facility and/or employer addressed any staffing shortages? Has your facility and/or employer approached the delivery of patient and/or resident care in light of staffing shortages? At this time, if you would like to provide input for question 1, please use the raise hand button at the bottom of your Zoom screen. As a reminder, please start with your name and the name of your organization before providing your feedback. I know it can be a little intimidating to be the first person, but don't be shy to jump in.
Again, if you'd like to ask or answer this question, you can use the raise hand function at the bottom of your screen and we can help unmute your line. Katie, there are no hands currently raised.
Okay, we will go ahead and move to question 2. We'll now hear your feedback on question 2, which is, what are some innovative approaches that your facility and/or employer has taken to address the impacts of emergency situations on healthcare staff? Again, at this time, if you would like to provide input for question 2, please use the raise hand button at the bottom of your Zoom screen. For anyone joining via phone, please press star followed by the number 9 to raise your hand to join the queue. Do the same to lower your hand if you wish to be removed from the queue. When your line is open, press star followed by the number 6 on your phone to unmute yourself. When speaking, please start with your name and the name of your organization before providing your feedback. We will now hear any responses that folks have to question 2.
We have our hand raised by Michelle Hallowell. Michelle, you'll be prompted to unmute in just a moment.
Hello, my name is Michelle Hallowell. I'm with the Ponca Tribe of Nebraska, Fred Leroy Health and Wellness Center. I don't know if this is real innovative approach, but we have 3 clinic facilities, Omaha, Lincoln, Ponca Health Services, and Norfolk. And there have been a couple of instances where health staff we were notified that certain health providers or health staff would be out due to COVID, them either having it or quarantining several staff members. So what we did is our health staff would basically send one of our providers to one of the other facilities that needed help if their provider was out or if the scheduler or patient registration was out. So that's how we approached our situations.
Thank you for your comment. We'll give other folks a chance to raise their hand if they'd like to provide any input.
We have a hand raised by Julie Ramsey. Julie, you should now be able to unmute yourself.
Hi there, can you hear me?
Yes, we can.
Okay, so I guess tackling 1 and 2, what we've had to do is basically layer our staffing, hire extra staff in some of the more key positions like our medical assisting and dental assisting, keeping open positions out there so that we're constantly hiring has been a thing. But we've also had to raise salaries to be competitive in the market as well. And then we've also been flexible as far as going from in-person to telehealth as needed based on staffing shortages or increase in pandemic numbers in the area, things like that. We have 5 locations over 3 counties in Central California. So we also do send staff to any of their facilities to try to mitigate any shortages.
Thank you for your comment. We'll see if anybody else raises a hand to answer question 2.
Okay, it appears we don't have any additional hands raised.
Okay, we will go ahead and move on to question 3, which is what resources are available in your community to support healthcare workers during and after emergency events? At this time, if you would like to provide input, please use the raise hand button at the bottom of your Zoom screen.
Susan Carroll, you have your hand raised. You should be able to unmute your line.
Sure, thank you. So it's Dr. Carroll, and I know I'm not officially on the tribe side, but I am someone that has had the opportunity during COVID to be out in the workforce. And I just wanted to give you just quick answers to the first 2 bullets. How has the extended duration of the COVID-19 public health emergency affected the workforce at the facility that I was at? It affected it greatly. It was complicated because the site I was at was also having a very hard time with its own staff being affected by COVID. There were a number of deaths, so it made the entire facility really in a crisis setting. It was complicated by hospitals in the surrounding communities increasing the reimbursement for healthcare workers, and many of the healthcare workers at the facility I was at left to go to those additional hospitals, which created an even greater staffing shortage. How they responded to that was just that, to bring in public health service providers, clinicians, support to help the facility. So they utilized the U.S. Public Health Service. And then some of the innovative approaches that the facility that I was at addressed some of the psychosocial aspects of care of the medical staff, included having their behavioral health program on a daily basis, work with staff to provide the ability to take an hour off, to be creative, to talk about their issues, and to be heard about what they were going through at work. And in many ways that did help lessen the impact of the emergency situation for that staff that was, pedaling very hard to keep up with all the needs. I'll stop. Thank you.
Thank you for your comment, and we'll give folks just another minute to see if anyone has anything to respond to for question 3.
Katie, I don't see any additional hands at this time.
Okay, sounds good. We will go ahead and move on to question 4, We would now like to hear your feedback on question 4, which is, how often, if at all, do you participate in emergency preparedness exercises, and what do those exercises entail? How did the exercises prepare you to address actual emergency situations? At this time, if you would like to provide input, please use the raise hand button at the bottom of your Zoom screen.
We have a hand raised by Deborah Santiago. Deborah, you should now be able to unmute yourself.
Hi, my name is Deborah Santiago, and I'm from the Oneida Nation. So here in public health, we offer 3 mass influenza clinics every year. And that has prepared us for obviously COVID. When the vaccine came out, we have been practicing our mass influenza clinics for approximately the past 10 years. We have a designated point of dispensary at our elementary school, and our community is very familiar with that. They have been coming and attending those clinics, getting flu shots. We do 3 in person. Well, in the beginning, we offered 3 in person, but then due to COVID, we started incorporating a drive-through. That was really well taken by our community because they didn't have to get out of their cars. You know, COVID was super high at that time. This was in 2020. And we've continued those drive-through clinics throughout even this year. So those really helped us prepare for when the COVID vaccine rolled out. That's all.
Thank you for your comment. We'll give folks just another minute to see if anybody has any feedback for question 4.
I'm not seeing any additional hands raised at the moment.
Okay, sounds good. We will now hear your feedback on question 5, the final question, which is, what can CMS do to ensure a more resilient healthcare workforce to withstand future emergencies? At this time, if you would like to provide input, please use the raise hand button at the bottom of your Zoom screen. Once you are called on, please unmute yourself and state your name and organization and begin providing your feedback. Okay, it looks like we don't have any hands raised for question number 5. In wrapping up this very quick listening session, at this time, I'd just like to take one additional minute to see if there are any other participants who have any input to share on any of the 5 questions that we discussed today. To share input that you may have, just click on that raise hand button at the bottom of your Zoom screen. Okay, I'm seeing no hands raised. As we're nearing the end of this call, we'd like to thank you for participating in today's CMS virtual listening session to gather information from Indian Health Services, tribal and urban healthcare providers, and emergency response staff on emergency preparedness. As an opportunity to provide additional information outside of what was shared during today's session, CMS is accepting written responses to the 5 questions discussed today. You may send those comments to CSG listening sessions, that's plural with an S, at cms.hhs.gov. However, please note that CMS will not be responding to written input. It will be used to inform ongoing policy review. I will now turn it over to Beverly for some closing remarks.
Thank you again, Katie. Thank you so much for that presentation and allowing folks to provide that feedback. It can be very helpful. And thanks to all the participants who did provide feedback for today's listening session. So that will help inform some of our policy decisions here at CMS, which is always helpful. And keep in mind that you can still send written comments to the message link listed here again, and that's CSG listening sessions with an S at cms.hhs.gov. Again, I would like to thank everyone who participated on the webinar today, and would like to remind you that materials from today's webinar will be posted on our spotlight page at the AINAN Outreach and Education website. So that's again at go.cms.gov/AIAN under all tribes calls. And the recording will also be posted there. So as always, you can submit any comments to us or anything that you want to talk to or send comments to the Division of Tribal Affairs. Our mailbox is at tribalaffairs@cms.hhs.gov. So thanks again and have a great afternoon.